Our Cabinet Secretary, Ministry of Health, Dr. Deborah Barasa, the Chair of KEMSA Board, and board members of KEMSA, our DG, the CEO of KEMSA, Madam Lois, the Presidential Economic Advisors who have joined us today, staff of KEMSA, good afternoon. Indeed, it's a pleasure to join you today, Madam CS, on this very memorable occasion where, as we prepare the nation for the UHC's launch, rollout tomorrow, this visiting KEMSA here today is a testament that indeed the ministry and the government is ready to roll out UHC. As you're aware, universal healthcare leverages on key pillars, among them commodity security. Tomorrow we are rolling out the digital system, which is one of the key pillars of delivery of UHC. Without commodities, then it will be very difficult for us to achieve universal healthcare coverage. It is indeed gratifying to hear from the chair of KEMSA the reforms that have been initiated here. We've seen in terms of digitization as one of the key ones, where the customers of KEMSA, who are the county governments, are able to track and trace every order that they have placed with KEMSA. We know that KEMSA has had challenges, but I want to thank this board, and now the new chair has come on board, that you are continuing with the reforms that were initiated earlier. One of the issues that I want to call upon on the KEMSA staff is diligently serve the authority and serve the nation. We know you are committed. We know you have been working under very difficult circumstances, but as a government, we shall continue investing in digitization for the purpose of your work being easy. One of the key areas that KEMSA has always been accused of is on the procurement. And I believe with the digitization, where you have end-to-end, we'll be able to see orders being placed without discrimination, without any collusion. That's the KEMSA that we want to see. And I'm happy that the board and the management has put in place all the necessary investments for the purpose of this. I am aware that you've invested in the new ERP system that will be able to facilitate that. Together now with the digitization through the Kenya Digital Health Agency, you will be able to integrate the entire health ecosystem. You have mentioned, the CEO has mentioned the issues of recapitalization. Indeed, we are making progress. One, the reforms that we are undertaking under the social health insurance will be very easy in future, because as you supply to the counties and supply to the specific facilities, they will be able, because through the facility improvement fund, those facilities in future will be able to place their own orders, because they will have been reimbursed of what they have spent, because through SHA, they will be able to get the claims from Social Health Authority and then pay KEMSA directly. So it's very difficult, Madam CS, where the counties owe KEMSA money, they are not able to pay KEMSA. And also, I can now say the former NHIF, because starting tonight, midnight, there will be no more NHIF and we shall have SHA, where NHIF are not able to pay the claims from the counties, and therefore leading to short supply of drugs and commodities by KEMSA. This is going to be a thing of the past, because with the digitization, we're able to see how much is owed to KEMSA by the counties or the facilities, and we shall be entering into an arrangement with the SHA authorities so that they are able to pay KEMSA direct. The biggest challenge was, how can we get the money from the source? And the Constitution does not provide for that, but I believe the current laws that were passed will be able to facilitate that because of digitization. So with those few remarks, ladies and gentlemen, I want you to join me in welcoming our Cabinet Secretary to give our remarks, and then